And Canada. Being a part of the scientific committee, I was extremely happy being a part of the organization. It was a great pleasure to be in this part. We were overwhelmed by the responses we received from outside India. We received more than 525 competitions in which the national talent with. It was extremely happy to be in the part of with. Thank you for giving this opportunity and finally all the best to the fight. I'm Saturday. Being a part of the scientific committee, I was extremely happy being a part of the quiz organizing team. It was a great pleasure to be in this part. We were overwhelmed by the responses we received from the India. We received more than 525 teams competing in this equator national level quiz. It was extremely happy to be in the part of quiz. Thank you for giving this opportunity and finally all the best to the fight.
When people's problem at this part, if they want to learn, this is the question and the timing and
So you can put the timer in the default or slide on the input timer.
This is a very old. What is it? Settings
Download
it was I have copied in that folder, desktop folder.
yeah, yes, yes.
Minimum 10 seconds delay. Then it will be
I'm Tanmay. Being a part of scientific committee, I was extremely happy being a part of the organizing team. It was a great pleasure to be in this part. We were overwhelmed by the reports we received from India. We received more than 525 teams competing in this equational national level quiz. It was extremely happy to be a part of this. Thank you for giving this opportunity.
the first video on the Koims video. That's not, and then we're going to start this, okay?
You have to add that timer to the slides.
Yeah. You have it?
Yes. ಅದರಿಂದ
ಜಾಸ್ತಿ ಸ್ವಲ್ಪ ಟೈಮ್ desktop
Desktop focus scratch. That's what we system. 60 seconds.
To put the timer, we already shared this screen. So we'll do that and
Yeah.
Hello, am I audible?
Not at all, actually.
Hello.
Yes, you are.
A very good evening to one and all. Incustra2020 National Level Online Quiz on Otorhinolaryngology and Head and Neck Surgery, hosted by the Department of ENT of Kodagu Institute of Medical Sciences, Madikeri, Karnataka. With the guidance and support from the Department of ENT, we, the students of Abhinavas, the batch of 2017, along with other members of our college, wanted to bring something fruitful amidst this pandemic. We received an overwhelming registration of more than 500 teams from over 20 states and 100 medical colleges across India. 100 teams were selected for quarterfinals and 25 teams made it to the semifinals. And finally, here we are with 5 teams who successfully outwitted the other teams. So, now let me introduce our top 5 finalists. Team 1, Vivek Nayak M and Aditi from Kasturba Medical College, Manipal, Karnataka. Team 2, Kabaleshwar K and Akash S from Government Stanley Medical College, Tamil Nadu. Team 3, Sthita Prajna Mohanty and Siddharth Lenka from All India Institute of Medical Sciences, Bhubaneswar. Team 4, Aishwarya Srinivasan and Janavi from Madras Medical College, Tamil Nadu. Team 5, Sarath Satu and Divya Bajaj from Jipmo, Pondicherry. I welcome you all. Now I would like to welcome today's quiz master, Dr. Shweta Ma'am, Head of the Department, ENT, Kodugu Institute of Medical Sciences, Madikeri. Once again, a very warm welcome to you all and all the best for the finalists.
We're just checking if all the teams are here. A very good evening to all of you. To begin with, let me tell you that we have 2 people who will be keeping the scores and we have 2 people who will be keeping the time. And while the content is being uploaded onto this system, I welcome you all to this. I welcome you all to this online quiz. This has been an initiative by our students. They have pushed us forward to come up with this. And because of the pandemic that's going on, it's become a little difficult for students to keep up with their academics. And these kind of initiatives, I'm sure, will help them in keeping up with their academics. And the enthusiasm with which students have taken part in the quiz shows it all. And I must say, they have answered even postgraduate level questions, and the undergraduates from the various parts of our country are doing a great job in their academics. With this, we'll start the quiz. First on, I'll display the rules of the quiz. I hope all the students who have logged in, all the teams that have logged in, are able to clearly see what is being displayed. If not, you let me know. Once I start sharing the screen, you'll be able to see whatever will be displayed. I want to see the students. Their video is not seen. Yeah, I request all the students to turn on your videos. I'm not able to see the students in the conference All the students participating in today's quiz, kindly turn on your videos. Can we have a check on the audio? Audio is clear, right? You can message in the chat box if there is any problem. I can't see. I think they turned on. It's seen here. We can see only team 5 is on with their video, but I want the rest of the teams also to switch on their videos. Yeah, we can see a few more team members here right now. Team 1 is with us, team 2 is with us. Yeah, what about the team 3? Team 3, yeah. Team 3, the students are together. And team 4 is also with us. Team 5, yeah. We have all of them here. Stop it. Yeah, that's another. Team 1 is here. Team 2. Team 1, we don't have another participant. Team 1,
Hello.
you're participating alone?
No. Hello. Can you
Yeah,
hear
yeah.
me?
Yeah, I can hear you.
Actually, my video just comes right in the middle of the screen. How do I just put it to the side? I can't see the screen that's being displayed. Like my video itself is in the middle of the screen.
No, I didn't get you. If you're turning on your video,
Yeah.
your face is coming right in the center, is it?
Yeah. My video is there in the center. I can't see I can just see the peripheral part of the
You
screen.
double tap on that and swipe it to the corner.
Okay. No, it's not happening.
Your face is viewing, right? Just
Can you
click on
see
it
my
and-
video?
No, your video
No.
is not seen.
Switch
Yeah,
this,
yeah.
yes.
Now it's seen.
Okay, fine. It went now. Yeah, I mean my video is not
Okay.
there in the center.
Okay, fine. So we are here with all the 5 teams. Yeah, all of them are nicely seen. So no, I don't want to start sharing like this. This question will be seen now. No, I think we can do this and then start sharing this. This display. It will not display. Now let's have a check on the video. The screen is nicely seen, right? All the students can see the screen, right? There's no problem with it. Yeah. Okay. So let me just put up the rules for you. So your answer should be given within the specified time limits, failing which it will not be considered. Okay, and you have to keep your video turned on for the entire length of the quiz. Audio should be turned on once it's your turn to answer. Okay, and the time limit and points will be mentioned at the beginning of each round. Okay, that's clear with you all, right? We've already told this to you before. And we have 2 people who will be keeping the time. Also, we have 2 people who will be keeping the score, so you don't have to break your heads about that. Now we'll straight away start with the round 1. Okay. Now round 1, we call it figure it out. Okay. You got to figure out what the image that's on display. Okay. The first round, round 1A, is very simple. I'm sure all of you will get it right. Okay. And you have to identify the image within 30 seconds of its display. Okay. This will be followed by 2 questions. You have to answer that within the next 30 seconds. So totally within a minute, you have to get this whole, you have to be done with this round. Okay. And the points are 10 points for you for your identification of the image and 5 points each for the question that follows. Okay. Once you answer one question, you get 5 points. The next question, you get 5 points. Right? This is clear with you, right? And in this round 1A, we're not going to pass the questions to the next team. So the team that is asked is supposed to answer. We're not going to pass the questions. Okay. Now the timers, the students are ready with keeping the time and the score. Yeah, the timer. Once I tell you to switch it on, you switch it on. Score also, I'll tell you what the score is. Okay, team 1. I can see the 2 of you from team 1. You can switch on your audio. Okay, and your question is this.
It's a myringoplasty
Okay.
underlay.
Okay, that's your next question. Okay, so you get 10 points for myringoplasty, 5 points for the technique, that is underlay technique. This is your third question.
Temporalis fascia.
Okay, great. So 20 points for team 1. I'm sure this round all of you will get it. We start off with the quiz with the positive vibes that all of you are going to gain points. Okay, so 20 points for team 1. Now the next team, team 2. Yeah, can I have you people unmute yourselves? Okay, so team 2, your question, oh, sorry, these are the answers to the previous question. The team 2, your question is this. What is the structure?
Basilar membrane.
What is it? Is that your final answer?
Tongue, ma'am.
The time is up. 30 seconds. Yeah, 30 seconds is up. This question is not going to be passed. So your time is up, but you can think about the answer. You're not going to get points for it though. At least now you should be able to get the answer.
Yeah, olfactory epithelium.
Yeah, this is the olfactory epithelium, isn't it? And what are those structures marked A, B, and C?
Receptors of the olfactory epithelium.
Yeah, receptor epithelium. What is B? What are the supportive cells called
Supporting
as?
cells of the olfactory epithelium.
Yeah, supporting cells are called as tentacular cells, isn't it? And C is the olfactory bulb with the mitral cells in them, right? And the substance that gives odor to odorless gases, methyl mercaptan. You must have read it in your school days, I think. Okay.
Yeah.
So team 2, you haven't scored a point. Not to worry. There are many more rounds to go. Next on, we'll have team 3. Team 3, unmute yourselves.
Hello.
Yeah. Yeah, team 3. I can see the 2 of you together. So team 3, your question is this. Identify the structure.
Larynx.
No, there's something marked in green, no? What is that? You still have 10 seconds left.
Cricothyroid muscle.
Okay, cricothyroid muscle. That is the right answer. You guessed it. That's not what you knew, right? It's a cricothyroid muscle. What is its nerve supply?
External laryngeal nerve.
External laryngeal branch of?
Superior laryngeal.
Yeah. What is the action of this muscle?
It's a tension of the adduction and tension.
Yeah.
It
This
is the tensor of the
connectivity
vocal
issue.
cord. It is the tensor of the vocal.
It what?
Tensor of adducts and it tenses.
It tenses the vocal cord. That's what you're saying, right?
Yes, yes.
Yes, we give you the points. So 20 points for team 3. So this is a cricothyroid muscle. It is the only muscle which is supplied by the external branch of the superior laryngeal nerve, and it is a tensor of the vocal cord. Okay? Yeah. Next team, team 4.
Yes, ma'am. Am I audible?
Yeah, you're audible. Yeah. Your question is this. What is this given in this image?
This is the infundibular middle meatus.
Have a close look at it. What is this structure? What is this procedure in the image?
Douching. A car. Say. Is it douching?
Douching, or what else is it?
Antrostomy.
Yeah. Okay. 30 seconds. Exactly 30 seconds you get it, but it's not the complete answer. What antrostomy is it?
Inferior meatus.
Inferior meatal antrostomy. Okay. Indication for this procedure.
Chronic maxillary sinusitis.
Okay. Another 5 points for you. Yeah. What is performed nowadays? Is this performed nowadays?
Fess. This is not performed. Fess is performed.
Your time is up. Sorry, you're getting the right answer, but your time is up. Okay.
But I
1 minute is.
Fess. We told Fess, no, ma'am. This is not and Fess.
What?
We told this is not performed and Fess is performed. So.
Okay, I give you the points, but you have to be on time. Okay, just a second. You would have missed it just by a second now. Okay, so what is it in the fest that we do nowadays? In fest for maxillary sinus, what is it done? What is the surgery that's done?
First, ansinectomy.
Yeah, ansinectomy. No, for maxillary sinus, what do we do? Specifically.
Inferior infundibulotomy.
It is called as a
procedure,
middle meatal antrostomy. This is inferior meatal antrostomy, right? So similarly, we do a middle meatal antrostomy. Okay. So this is not done nowadays because it's not physiological. 20 points for them. Okay, I'll give you the 20 points because it's about a procedure. Okay. Now, do we have team 5?
Yes, ma'am.
Yes, ma'am.
Yeah, team 5, you're here with us?
Yes, ma'am.
Yeah. I'm just waiting to see you. The others can mute yourselves. Team 5.
Ma'am, we are unmuted.
Okay. Yeah, I can see you. I can see you now. Okay, team 5, your question is this. You have to identify the structure that's pointed to the star. This is the endoscopic picture of the middle.
Cochlear Livia.
I'm not that sure, sorry.
Is the
Hold it.
processus cochleiformis?
The time is up.
Processus cochleiformis?
Ma'am, can
It's
you
something
hear?
coming from the processus cochleiformis.
That's
Tendon of stability.
What attaches to the processus cochleiformis, hooks around and comes onto the malleus?
Tensor veli palatini, ma'am.
The muscle.
Tensor.
Tensor tympani.
Tensor
Tensor
tympani,
tympani.
sorry.
Your time is up. Your time is up. You're not going to get any points for this. Okay. So the next question is, what is its action and what is the innervation?
Ma'am,
So
Trigeminal
act-
innervation.
your
ma'am,
time is
in
up.
action.
Okay. You're not going to get any points, but you can attempt the question. Yeah. What is its action?
Ma'am, it tenses the, like it moves away the stapedius so that it weakens
Stapedius or
the.
which muscle?
Malleus.
It's attached to malleus, isn't it? You're talking about the stapedius. This is tensor tympani. So it pulls the malleus and it stiffens the tympanic membrane, tenses the tympanic membrane. Okay, that's why the name tensor tympani, isn't it? Okay.
Ma'am,
So
but we told the innervation earlier, no? Before that.
no, but your time is up. Your 1 minute is over. After that, you're giving the answers. Okay.
Ma'am, team 4 also got extra time.
No. I haven't given them extra time. Just on the dot of the 60 seconds they have told.
Okay, ma'am.
But ma'am, we weren't told about that, no? That 60 seconds is up.
And let me tell you one more thing. Only if you get the first, yeah, I've told you in the beginning, right? You have 30 seconds for your first
But
question.
only the 30 seconds was told, no? Matlab, I have some confusion. I'm not arguing or something. Like in the
Okay.
first question, you told 30 seconds is up. Then you displayed the second question. And then the
Yeah.
third question.
And
Third
after
question,
that,
I
your 1
told that
minute is also.
trigeminal
but
3, I told. And then you told that the time is up. But
Let
before
me
that,
tell you one thing. Only if you identify the structure correctly, you get the points for the other questions that follow. Okay. Only if you
Oh,
identify
okay.
the structures, you get the other points. Otherwise, you don't score any points. Okay. First, you have to identify the structure, right? Okay. So this is the tensor tympani muscle, and it dampens loud sounds. That's its function. And it, like you told, it is innervated by the trigeminal nerve, the mandibular division, which gives the medial pterygoid nerve. Okay. From there, we have a branch to the tensor tympani. Okay. Now with this round, we have our scores: 20 to team 1, 20 to team 3, and 20 to team 4. Okay, and team 2 and team 5 will start scoring now. Yeah, there is the scoreboard. Okay, now we can move on to the round 1B. Yeah, and now on, I'm going to announce it loud and clear when the 30 seconds is up and when the 60 seconds is up. Okay, so no confusion. We're going to announce it loud and clear that your 30 seconds is up and now your 60 seconds is up. Okay. So next on.
Small request.
Yeah.
Can you display the timer if possible?
No, we tried that, but there's some confusion with the slides.
Okay.
We don't want the questions to be disturbed. That's why we're not doing that. Okay. I'm really sorry about it. We wanted to have it on. Okay. But we'll make sure, nobody is missing out on the time. We'll tell you, we'll clearly announce that your 30 seconds is up and your 60 seconds is up. Okay. Yeah, you all can see the screen, right? Okay. Now next on we have again the team 1. This is again, figure it out, the first round, the second set of questions with the first round. Like I already told you, now I'll repeat it once again so that it's clear to all of you. So the first 30 seconds is to identify the image that's on display, and you get 10 points for this. And the next 30 seconds is for you to answer the 2 subsequent questions. And only if you get the first question, only if you identify the question, the structure, will we go on with the next 2 questions and you can answer them. If you don't get the structure right, you're not going to answer the following questions and your points will not be given for that. Okay. So team 1, are you ready? Unmute yourself.
Yes, ma'am.
Yes, ma'am.
Yeah, I can see team 1. What is this deformity shown in the picture?
Vivek, do you know?
And Andy deformity.
Yes, excellent. This is the Andy gum deformity. They get 10 points for that. The next question, which is due to defect in which part of the bone?
Mandible.
Which part of the mandible? I'll give you the points, but okay. Your next question. Yeah, next question is mention 2 causes for the above deformity. What would cause this kind of a deformity without the mandible?
Treacher-Collins syndrome.
Okay, congenital causes. What else?
Surgical cause.
What surgical causes?
Mandibulectomy.
Yeah, mandibulectomy. Okay, good. So this is the Andy gum deformity, which is seen in defect of the anterior mandibular arch. The causes are ablative head and neck surgeries. Okay, this is the most common cause. And then congenital causes. And also in old and edentalist patients with atrophic mandible, there can be body fractures, and we can see this kind of a deformity. Okay, 20 points to team 1. Now team 2, unmute yourself. This is your question.
Carotid artery.
More specific, what is highlighted? Yeah? Loudly, please. What has branches in the neck?
Internal carotid.
Internal carotid has branches in the neck. Okay, your time is up.
Understand?
Your time is up. Yeah, your time is up, team 2. This is not internal carotid. In fact, internal carotid has no branches in the neck, isn't it? It is the external carotid which has branches in the neck. Okay?
Okay.
And what is this imaging study called? Any idea?
CT angiogram. Angiography.
Okay, it's an angiogram. It's actually a digital subtraction angiogram. Okay. Can you identify the 7 and 8? You're not going to get points for this. Let me tell you once again, only if you identify the structure correctly, then you get the points. Okay. Can you identify branch 7 and 8? Those are terminal branches. I'll give you the clue. Those are terminal branches of the external carotid artery.
Ascending pharyngeal.
Marginal mandibular. Ascending pharyngeal. No. Those are not terminal branches. Terminal branches. What comes as a main supply to the nose?
Spinopelvic
The branches from this artery number 8. Okay, I'll give you the answers. Like I told you, it's the external carotid artery and its branches. It's a digital subtraction angiogram. And number 7 is a superficial temporal artery. And 8 is a maxillary artery of utmost concern to us as ENT surgeons, right? Okay. Yeah, you don't get any points, team 2. Sorry to say, you don't get any points. Difficult question though. Okay. Next, do we have team 3?
Hello.
Yeah, team 3 is there.
Hello.
I hope you are enjoying this quiz. Participants.
Yes, ma'am.
Yes. Okay, team 3. Team 3, I can see the 2 of you. Your question is, yeah, you're audible. Okay. Your question is here, team 3. Name this sign.
Battle sign.
Yeah.
Battle sign.
Yes, very good. Where is it seen?
Fracture, skull base fractures.
Yes, very good. Next, name the eyes associated with the above sign. There is another eye sign. What we see?
Raccoon
Yeah,
eyes.
loudly.
Raccoon eyes.
Excellent. So this is the battle sign seen in skull base fractures, and the eye sign we see is called as the raccoon's eye. Okay, also called as a panda eye. Okay. So 20 points for team 3. Okay, next team 4. Do we have team 4?
Yes, ma'am.
Yeah, to the team 4 students. Now I'm going to make it very clear for you about the time, so you'll have no confusion. Okay. This is your question. Your time starts now. What is this triangle? Oh. There's some triangle that is shown.
Ma'am, Beer's triangle. BOEHR.
Bear's triangle is for something else. This is some other triangle. Close to it.
Anterior triangle of the neck.
No, it's not anterior triangle of the neck. Okay, your time is up. Your 30 seconds is up. The boundaries and the contents of the next question. Okay. So you came close to it. It is related to the thyroid. Okay. It's called as the Jones triangle or the sternothyrolaryngeal triangle. Okay. And the boundaries are upper pole of the thyroid gland and superior thyroid vessels. Superiorly, the attachment of the trap muscles. Medially, it's the midline. Floor is formed by the cricothyroid muscle. And the most important structure we identify is the external branch of the superior laryngeal nerve. Whenever we do thyroid surgeries, this is the triangle to identify the external branch of the superior laryngeal nerve. Okay, sorry to say you didn't score your points this time. Okay, next on, do we have team 5 for the next
Yes, ma'am.
round?
Yes,
Yeah,
ma'am.
team 5. Yeah, once I start seeing you both, your question will be on display.
Hello.
And once the 30 seconds is up, I'll make it clear to you. Okay. Yeah, I can see the two of you. Your question is here. What is this? What is this kit?
देखो आता है ये सारे मुझे नहीं आता
Endotracheal tube. Endotracheal tube insertion kit.
It's not endotracheal.
Oh,
Tracheostomy
tracheostomy kit.
tube.
Ma'am, tracheostomy is there, and we have to cut the trachea and then insert the cuff tube. and all.
Tracheostomy,
Tracheostomy.
your time is up. Okay, and it's not a tracheostomy kit. Tracheostomy tubes are not this small. It's something very small. Okay, whatever is given.
Cricothyroidotomy.
Yeah, that's the right answer, but your time is up. Okay, I cannot give it to you. So this is a cricothyroidotomy kit. Okay. So we'll not have discussions about this question because your
Contraindication
time.
is in kids we can't do that, and complication is glottic subglottic stenosis, hemorrhage maybe.
Okay, so I'll give you the answers. So this is a cricothyroidotomy kit. Whenever there's a neck mass, it's an absolute contraindication. If there's a tumor in the neck, anterior part of the neck, okay, and in obese patients, we don't do it because it's more frequently associated with complications. And some of the complications are paratracheal entry. It can go into the paratracheal gutter. It can damage the posterior wall of the trachea, cause surgical emphysema, hemorrhage. Okay, so this was your question, and now this is the end of round 2 of the first round, round B of the first round. Okay, and with this, we have the scores on display. Yeah, so team 1 is with 40 points, team 3 is with 40 points, and team 4 is with 20 points. Okay. Now the next round. Okay, the next round we're going to pass it to the next team. Okay, the next round. Yeah, you can see the screen back on display, right? Now this round, the third part of the first round, round 1C, we are going to pass this on to the next team. Okay, in case the first team doesn't answer, it will pass on to the next team. And the next team doesn't get any time to answer. You have to answer immediately or it passes to the other team. Okay, it goes on like that. And the teams that, the question when it is passed, they don't get the full marks. They get the half marks of that. That is 5 plus 5 only, not 10 plus 10. Okay, so they get 5 plus 5 only. Okay, so team 1, are you ready?
Yes, ma'am.
So team 1 is ready. So let's go. This is your question. What is this? What is this? What do we use it for? What is this? Your answer, give me the answer as to what this is.
Vivek, do you know this?
No idea.
It's difficult for you students. Round 3 is supposed to be difficult, right? You're running short of time?
Atomizer.
No. Your time is up. Next team. Team 2. Do you know this?
No, ma'am.
Team 3. Do you know what this is?
It's used for syringing of air.
No, it's not. Team 4.
No, ma'am.
No. Team 5.
Ma'am, is it CSF tap to collect the CSF from there?
No, you didn't get it right. But it is used to trap something. It is not CSF. We are not going to trap CSF, right? In ENT, we need to do a sinus trap. Okay. So this is a sinus secretion collector. Okay. It traps the sinus secretion. Whenever we are doing FES, when we have to collect a sample, we keep this in the suction and it collects the sinus secretions. Okay. And the use is to collect nasal, paranasal, or even ocular secretions. Okay. So this is a trap. All right. So next, team 2. So team 1 doesn't score a point for this. Next, can we have team 2?
Yes.
Team 2, kindly unmute yourself. Yeah. So team 2, your question is this.
Temporal.
No, identify 3. I'm not going to give you such an easy question, right? Identify what is 3. Yeah, loudly, please, if you know the answer. Loudly. You're running short of time.
Petroscoma suture, corner septum.
It's some groove. Okay, so time is up. It's a groove for some vein. What runs along the superior part of the petrous bone? Which vein?
Master emissary.
No. It is the groove for the superior petrosal sinus. Okay, along the superior part of the petrous bone and the inferior part of the petrous bone, we have
Wasn't it
veins.
supposed to be passed?
And ma'am, this
Questions
is
would have been passed.
Oh, I forgot about that. Anyways, that's okay. I think the next question on, I'll pass it to you. Okay, that mistake was mine. Okay. Okay, did you all know the answer to this by any chance? Yeah, students? I think it's a difficult one, isn't it? Okay, anyways. Sorry, I didn't pass it to you, but the next question on, I'm definitely going to pass the questions to you. Okay. So this is a superior petrosal sinus. And what does it drain into? I put up the answer for you already. It drains into the transverse sinus. Okay. Now, what I will do is, in order to bring a uniformity to this quiz, I'm not going to pass the questions in this round. Okay. Because I didn't pass the second question. Okay. Otherwise, it will not be fair. Anyways, the first round, when I pass it, nobody has answered. So I'm not going to pass the questions to you. Okay. So that way it will be fair. Now, no passing on the questions henceforth in this round. Okay. So team 3, are you there? Yeah, I can see team 3 there. So your question is this. You're running short of time.
Surgery for cleft lip.
No, it's not. Yeah, your time is up. Your time is up. I'm not going to pass the questions to the other teams, like I told you. Okay. So these are the flaps that they use in plastic surgery for reconstruction after any excision of a tumor from that part of the lip. Okay. So this is called as a lip reconstruction surgery, and the flap that is used is the Abbey-Splandler flap. Okay. That's a difficult one. I don't expect undergraduate students to answer. If you answer, I presume you're postgraduates. Okay. So next, do we have team 4 with us?
Yes, ma'am.
Team 4? Yeah, I can see one member from the team 4. Where is the other member of the team 4? Have you unmuted yourself?
Yes, ma'am.
Okay, both of you are there, right?
Yes, ma'am.
So your question is here. What is this medical imaging method?
Video stroboscopy. Is it video stroboscopy?
Stroboscopy.
There is documentation like this. Stroboscopic is a video. When they document it like this, what is that called as? Your time is up.
No idea.
This is a video chymography. Okay. And this is a photographic recording of the vibrations of the vocal cord at the different positions. Okay. This is called as a video chymograph. Okay. Okay. Now with this we come to, team 4. Team 4 is done. Now we have the team 5. Do we have team 5 with us?
Yes, ma'am.
Yes, ma'am.
Yeah, team 5. All right. So your question is here. Identify the procedure.
Ma'am, this is emergency. No, which procedure?
There are no arrows showing any medialization or lateralization of the vocal cord.
Ma'am, what procedure is?
Vertical laryngectomy.
Ma'am, emergency tracheostomy.
No. Tracheostomy, you're not going to cut the larynx for that, isn't it?
Thyroid also. Vertical
Median
laryngectomy.
thyroidectomy.
Your time is up. Okay? Your time is up. What is a Grillo stitch? Anybody knows? No? Okay. So this is a laryngotracheoplasty. Okay, whenever a patient has a subglottic stenosis or stenosis of any part of the upper part of the trachea, we do this laryngotracheoplasty. Okay, and this Grillo stitch is a guardian or a sentinel stitch. Okay, once the plasty is done, you don't want the patient to extend the neck. So we place a stitch between the chin and the upper part of the chest or the manubrium, so that the patient is always keeping the neck flexed. Okay, so that is what is called as a Grillo stitch or a guardian or a sentinel stitch. Okay, I hope you're all learning something from the quiz, and I hope you're all enjoying the quiz. Okay, so we have the scores up. Okay, we give a break to the students. A 2 minutes break is all that is given. Okay, and we'll start off with the next round after this, after a 2 minutes break. In between, if anybody wants to tell something and share your experiences about the quiz this far, you can talk to me.
I think the questions are not of same difficulty in like it's separate 1A, 1B means like the questions are not of the same difficulty, ma'am. I feel that.
You
It's my
feel
opinion.
1A is not of the same difficulty, 1B is not of the same difficulty.
No, not like that. Not like that.
No.
In
For
the
each
team,
team,
For
each
each team,
for
the
the 1
questions
year
are not of the same difficult level.
because I got a radiology image, ma'am. Okay, it's somewhat difficult to answer rather than doing dissection images or any clinical imaging. You understand?
Okay.
That's
For which
what I
round
feel.
which round are you talking about?
Team 1B, I think. I got a
1B.
CT angiogram. Yeah.
CT angiogram. No, that
Yeah.
was a very straightforward question. I
Yeah,
asked you.
yeah,
See, I
actually,
asked you what is
my
this?
friend. My
What
friend
is
told
this
that he told
structure?
external carotid artery, ma'am, but you didn't hear it right. So
I didn't get you.
my friend told that he told external carotid artery, ma'am. Answer.
No, I heard it as internal carotid artery. That is
Yeah,
the answer
that's
you
what I
give it.
said, ma'am. That's what I say. But he told
Okay.
the external carotid. Okay, you didn't hear it.
Okay, but what we heard was the internal carotid artery. Okay,
Yeah, yeah.
and I made it quite clear. No, it's a structure in the neck. I think it is of the same level. I'm quite sure it is of the same level. Okay.
Okay.
Any other concerns anybody has? Okay, I think the 2 minutes break is up. We'll start off with the next round. See, the level I'm sure is the same because all of you have done really well. That's why you qualified. And this round that I just gave you 1C. Nobody has got an answer, no? So it is a difficult round, and I'm making sure I've made sure I've broken my head enough to make sure students don't feel this that they get a difficult question and the other person, the other team has got an easy question. All the levels I made sure it is quite uniform. Okay, so I think the score sheet was already displayed. So this is the round 2. Okay, and round 2 we've already shown you in our Insta quiz. Also, we give you some images. You have to connect and come to a diagnosis, right? So this I'm sure you all know. You all have seen it before, so you all know how to go about it. And here, now, my people who keep the score, remind me that we're going to pass the questions. Okay. So 60 seconds for you to arrive at the diagnosis or the syndrome. Okay. And you get 10 points for the diagnosis and 10 points for explaining the connections. Okay. 10 points for the diagnosis and 10 points for explaining the connection. And we're going to pass this question around. And the questions that are passed to the other teams, they get only 5 plus 5. And there's no time given to the next team. Okay. Immediately they have to answer and tell us what the connections are. Okay. Is this clear with all of you?
And do we have to explain the connections also within 60 seconds?
No, you have to get your answer within you have to arrive at the diagnosis within 60 seconds. Okay,
and then how much time do we get for explaining the connections?
No, immediately you have to give me the connections. Immediately after that, you get 60 seconds to come at the diagnosis. And immediately after that, it has to be followed by the explanation as to why you got that.
Okay.
Okay. Okay, is this clear with all of you?
What if we identify few of the connections correctly but not arrive at anything?
If you identify few connections correctly, not the others, then you will not get the diagnosis of the syndrome, right?
No, but
Only if you're able
for connections.
You want if you get the diagnosis correct, you get 10 points. Based on how many connections you get, we will divide your points and give you. But if you get the diagnosis correct, I'm sure you must be getting the connections correct, right? Okay. And once a diagnosis is arrived at, we are not going to pass the question. Okay. Once the students give the diagnosis, we're not going to pass the question. Only if the diagnosis is not arrived at, only then we pass the question. Is that clear? For just the connections, I'm not going to pass the question. All right. Now, any doubts or clarifications with this? No, right? Okay. So, team 1, are you there?
Yes, ma'am.
Yes, ma'am.
Okay. So, your question is here.
Charge syndrome, right? Vivek?
Yeah, I don't think it is charge.
Crying and ear
What
abnormality,
you say?
growth retardation.
Oh yeah, charge syndrome. Fine.
Charge syndrome.
Okay, excellent. That's the right diagnosis. Can you tell me what the connections are?
Vivek, what is the first one? What is
External ear abnormality along with the
growth retardation and ear abnormalities, and then
What
coinal
does it see?
atresia.
Yeah, coinal atresia.
What is the first one, Vivek?
Uh,
Uh,
What else is seen in Chart syndrome?
coloboma.
Coloboma.
Yeah. Okay. So this is the Chart syndrome. Okay. Where we see eye defects, choanal atresia, growth retardation, and ear abnormalities. They get 20 points for this question. Okay. This Chart syndrome is also called as the Hall-Hittner syndrome. Okay. Yeah. Now, team 2, are you ready?
Yes, ma'am. Akash?
Team 2, both of you ready, right? And whoever is giving the answer loud, and what we hear is the answer we take. Okay? Yes, team 2? This is your question.
Yes, ma'am. I didn't get the question, ma'am.
Yeah?
Hello?
Yeah?
I didn't
Tell
get the
me.
question, ma'am. Yeah.
It's on display.
Now only I got the question, ma'am. Akash?
Your time is up. Okay, we pass the question to the next team.
Recurrent left recurrent enlargement of the heart, dilated cardiomyopathy.
Yeah, what is that syndrome called as? You're getting the connections right. It's related to the heart and what else? Okay, next team.
Ortner
Team 4.
syndrome.
Yeah, what syndrome is it?
Ortner.
What is the other name for that syndrome?
Cardiovocal.
Yeah. Okay. So team 3 gets 5 points and team 4 gets 5 points. Okay, I think that is fair.
Okay.
They told us that there is a cardiomegaly there with vocal cord palsy. Okay. So team 3 gets 5 points and team 4 gets 5 points. Okay. So this is the Ortner syndrome or the cardiovocal syndrome. Okay, where there is hoarseness of voice, left vocal cord paralysis, left atrial dilatation, and mitral stenosis. It's because of the mitral stenosis all this is happening. Okay. So next, team 3 is ready. Team 3 questions, right?
Yes, ma'am.
Yeah, team 3 is ready.
Yes, ma'am.
Yeah, this is your question.
Vitamin B3 deficiency.
So it's a syndrome. You're running short of time.
IgG for thyroidopathy.
No. Okay. So your time is up. Now we pass it on to the next team.
Team, ma'am, yes, ma'am. Is it Asher syndrome?
Why do you say so?
Double lip, then that no, thyroid enlargement, and that lid, some chalasias, blepharochalacias. Not sure. Double lip, non-toxic thyroid enlargement, And then that eyelid, some blepharochalasia, some ptosis.
Yeah, very good. You get the 10 points, 5 plus 5 for this. Okay, this is Asher syndrome, also called as Laffer-Asher syndrome. Okay, and though you're not able to say what that is, you were getting at it. So there is edema of the eyelid. Okay, blepharochalasis, there is double lip, then there is non-toxic thyroid enlargement. Good, this was a tough one. Good. Okay, so team 4 gets 10 points for this. Okay, now next we have team 4.
Yes, ma'am.
Team 4, are you ready?
Yes, ma'am.
So your question is here.
Marfans. Ma'am, is it Marfans?
Think again.
Van der Hover. Aisho.
No.
That bridge is not there, and that opacity, then that thumb with. Is it corneal dystrophy or something?
Corneal dystrophy.
That what is that eye thing? Is it lens displacement or what? Yeah.
First one is
You're running short of time, girls.
The eye sign, that the eye picture, yeah. That nasal bridge is not there. And some deafness, then that thumb sign. Cataract.
Cataract.
Sir, enna varum?
You're running short of time. Your time is up. We pass it to the next team, team number 5. Do you have an answer?
Ma'am,
Ma'am,
Down
do we
syndrome.
guess anything to the connection?
No.
Ma'am, Down syndrome.
No, it's not. We pass it to the next team. 1.
Ma'am, do you know?
So tell me.
Is it Alport syndrome?
No. Okay, we pass it to the next team. Team 2.
Marshall syndrome.
What syndrome?
Marshall.
No, it's not. Team 3. Team 3 is the one who got this question. No, team 4. Team 3.
Kogan syndrome.
What syndrome?
Kogan.
Not Kogan. Okay, anybody wants to give the connections? Yeah, team 4 was giving us some connections, no? What is the first picture showing? Team 4?
Of the nasal bridge, then hearing loss, then corneal opacity, cataract, congenital cataract, and then the thumb sign.
It's not thumb sign. Okay, so this is a Stickler syndrome where the face is underdeveloped, mid part of the face, the nose and the cheekbones are underdeveloped. Okay, and the patient has hearing loss. All these are in your undergraduate books. I've not taken something which is not there, right?
Yes.
So the patient has eye abnormalities like cataract and joint problems like hypermobile joint, and they develop early arthritis. Okay, so next we move on to the next team. That's the last team, team number 5. Are you people ready?
Yes, ma'am.
Yes, ma'am.
This is your question.
Years, Anna Chacha. Ma'am, Meniere's disease.
No, it's not. It's not. It's a syndrome again.
Ringing bells and
Vertigo है, vertigo, tinnitus, headache.
Walk-Koniagi-Harada syndrome.
What syndrome?
Walk-Koniagi-Harada. VKH.
No, it's not. You have 20 seconds left.
Any idea, Divya?
I just know Meniere's only. These 3 symptoms is Meniere's.
Meniere's they'll not have. What is
Ma'am,
the first?
Apple's test wala posterior.
No, what is the first picture showing? That will give you a clue to the
Headache.
syndrome.
Posterior headache.
Your time is up. Next, team 1. Do you have an answer?
Is it Lermoyes syndrome?
No, it is not. Team 2?
Some superior semicircular descent syndrome.
No, it's not. Team 3?
Hello.
No answer. Team 4?
Acoustic
Hello.
neuroma related.
Okay. So,
Occipital headache, hearing loss, dizziness, and tinnitus.
I'm not giving it for the connections because all of them are getting the connections right.
Okay.
Okay.
Something related to acoustic neuroma. The
It's,
syndrome.
it's called as a Baroni syndrome.
Oh, okay.
Okay. This is the Baroni syndrome where the patient has unilateral headache in the occipital region. Okay. And they have ipsilateral recurrent deafness.
Hello.
Who's talking in between? Students, keep yourself muted. Okay. So this is the Baroni syndrome. Okay. So can we have the scores on display? Next round is also the same connections. So these are the scores at the end of the part 1 of the second round. Okay, A, 2A. Now we'll have 2B again, it's connections, but these are not syndromes. Okay, you can, these are all clinical disorders. Okay, we've given you some clinical pictures. You have to connect them and come to a diagnosis. Okay. So you can see the screen that is shared, right? So again, like I told you, this is again connections, but these are not syndromes. You have to come to a diagnosis based on the connections. And again, 10 points for explaining the diagnosis and 10 points for explaining the connections. Okay. And the question will be passed again. And the teams, when we pass the question, they score only 5 plus 4 points. 5 plus 4, note down, 5 plus 4, 10 plus 10 and 5 plus 4. Okay. Now team 1, are you ready?
Yes, ma'am.
Okay. So your question is, sure.
Vivek, it's type C curve. There is Toynbee's maneuver. No, Valsalva. Bubble. Then diving. Serous otitis media, right?
Serous otitis media will have type B curve, right?
Oh yeah.
Uh,
Eustachian tube dysfunction.
That's your diagnosis? You have 10 seconds left.
Eustachian tube.
Yeah, go ahead. Eustachian tube
Dysfunction.
dysfunction.
Barotrauma.
Yeah. Okay. So this girl gets it right at the last second. Okay. So this is barotrauma. So can you connect give us again what the connections are?
Yeah, deep sea diving. That's the mechanism of how it occurs. And there's type C curve, impedance auditory, and then there is bubble. There's a pop sound. It can be explained that way also. And the last one is Valsalva maneuver and examination.
Okay. So Valsalva improves it.
Yeah.
Okay, so they got it at the nth moment. It is otitic barotrauma. Okay. So this is commonly seen in scuba divers because of the variation in pressures. And the tympanogram shown there shows a type C curve. And usually chewing during descent of the flight will avoid this. You can avoid it by this otitic barotrauma can be avoided by chewing a gum. Okay, that's what we wanted to show. And then Valsalva maneuver may be done to avoid this again in order to fill in pressure into the middle ear. Okay, so yeah, they get their 20 points. Okay, next, do we have the next team, team 2? Team 2 is there? The two of you?
Yes.
Loud and clear now this time, okay? Your answers, loud and clear. Okay, so your question is here.
So Ludwig's angina.
Yeah. Connections, please.
That is external swelling in the submental region.
Hmm.
Then also there is a tender swelling in the submandibular region, ma'am.
Okay. What about the second connection?
Brownie woody consistency. Brown woody.
What?
Brown woody, ma'am. Brownie woody consistency.
Ah, woody consistency. Yeah. Then.
Yes. And there will be
Third one.
trismus, ma'am.
Trismus due to what?
Spasm of masseter muscle.
The muscle is pointed out there. And what is the third picture? What is the third picture showing?
Swelling in the sublingual swelling, Ludwig's angina, cellulitis of the sublingual space.
Okay. So there is elevation of the tongue.
Elevation of the tongue.
The last connection?
The muscle divides the space.
Yeah. So we're not going to pass this question because they got the diagnosis right. Okay. So this is Ludwig's angina. Whatever was told is right. Okay. So that is the internal pterygoid muscle in the parapharyngeal space because of the spasm. Okay. Whenever there is inflammation that spreads on there, there will be pain when the patient opens the mouth. Okay. So that one connection you didn't get. So I'll give you 17.5. That is your score. 17.5. Okay. 10 plus 7.5. That is your score.
Okay.
Okay. Next. Do we have the next team ready?
Yes, ma'am.
Team 3?
Yes.
Team 3, you're in the hostel, is it?
Yes, ma'am.
Okay. This is your question. Your time starts now.
Is it retropharyngeal abscess?
No, it's not.
Can you connect the images? Means you can explain the connections.
Your time is up. Your time is up. Sorry to say your time is up. Can we pass it on to team 4? Team 4, there's no time. You have to immediately give me the answer.
Is it myalgia, Eagle syndrome?
Yeah, this is myalgia. Connections, please.
The pain in the neck, ear pain, back pain because of impinging the nerve that supplies the deltoid. Then while swallowing also it is going to odynophagia. And then the calcification is shown in the X-ray.
Yeah, you can see the elongated styloid process. So team 4 gets 5 plus 4 points. Okay. Next, Which is the team which has to get the question? Team 5.
4, ma'am.
Team 4. Okay, sorry. Team 4. Team 4, are you ready?
Yes, ma'am.
Yes, ma'am.
So your question is, oh sorry, your question is here.
What, yeah?
A tumor orbit.
What is that red thing? Is it that
Laser,
laser?
red. First
What tumor or that's salivary gland tumor.
ಇಲ್ಲ அந்த ಇದು cerebral ಅಂಕಿತ ಇದು ಇರುತ್ತೆ. Final MRI.
And the lymph node metastasis. What comes here?
ஏதோ cancer.
தெரியல.
இது first one.
இங்க என்ன ஸ்வெல்லிங் வரும்? ஏதாவது pharynx spaces தான் இருக்குமா?
You're running short of time. Your time is up. Team 5, do you have an answer for
Ma'am,
this?
cystic hygroma.
Why do you say it's a cystic hygroma?
Ma'am,
Can
there
you
is
have
a neck
connections?
swelling, there is brilliantly trans-elimination, a neck swelling, and then because of blockage of lymphatics, and then there is MRI, lymphatics, and then there is a MRI of cystic hygroma.
Okay. So this is a cystic hygroma. Team 5 gets 5 plus 4 for this. Okay. So this is a cystic hygroma. It's seen in a child, a congenital neck swelling. Okay. This is associated with the lymphatics, right? It's a lymphangioma. It's brilliantly transilluminant, and the MRI is showing the cystic swelling on the right side of the neck. Okay. So team 5 gets 5 plus 4 points for this. Okay, next team 5, are you ready?
Yes, ma'am.
Yes, ma'am.
So your question is here.
This is
Blue
serous otitis media.
Why do you say
yes,
so?
ma'am. Ma'am, bol de Divya. There is a ma'am. You can see bubbles in the.
Air and fluid in behind.
That's serious. Then the flat tympanogram. No, what is this tympanogram?
And grommet tube. Type B. Grommet.
And then last one is adenoid hyperplasia. So it can cause hypertrophy. So it can cause this.
It is the most common cause of.
Okay, so team 5 gets 10 plus 10. Okay, so this is serous otitis media, also called as blue ear, fluid and air bubbles in the middle ear, adenoid hyperplasia, which is one of the most common causes, impedance showing a B type of curve, and grommet, which is a treatment. Okay, so can we have the scores on display? Right? Yeah. So these are the scores. Now we move on to the next round. So this is about diagnostics, round 3. And we are not going to pass the questions. Okay, there's going to be no pass. Whatever the team gets, they are supposed to answer that. Okay, the questions are not going to be passed to the next teams. Okay, so here in diagnostics, there are some images of some radiographic images that are on display, and you will have to come to the diagnosis of the disease based on that. Okay, come to the diagnosis of the condition based on that. Yeah. Turn it off. The 1 second. Okay. So this is diagnostics where the question is not going to be passed to the next team. You have to answer the question that you get. Okay. And you get 10 points to identify the image and 10 points for the subsequent question again. Okay. Question that follows is again 10 points. 10 plus 10. Okay. Now, is it clear with all the participants? Team 1. Shall we start off with the team 1 again?
The time again?
Time is again 60 seconds.
Okay.
Time remains constant, 60 seconds. Whenever there's a change, I'll let you know. Okay, so 60 seconds, you have to get the diagnosis, and followed by that, you'll have a question. Okay, so team 1, are you ready?
Yes, ma'am.
This is your question.
Does it look like these anchors divertically?
No, it's the distal part of esophagus, right?
Yes,
Barium swallow. But there is a filling defect there, a little bit in the middle. Is it apple core? But it doesn't look classically like that. And there is a stricture lower down. Is it achalasia? Can we go ahead? There is dilation, right?
Yeah.
Vivek passed.
Fine. Yeah. Go on.
Okay.
Achalasia cardia.
So what is the image?
Ma'am, it's a barium, like diagnosis, ma'am.
No, you tell me, what is the image?
It's a barium swallow showing distal end.
Yeah. Barium swallow showing achalasia cardia as your answer, right?
Yes, ma'am.
Okay. What is the name of the classification used to classify this disease?
Vivek, do you know this?
No idea.
Okay. They get 10 points. You're not going to pass the questions, okay? So this is the Chicago classification of achalasia. Okay. So this is achalasia cardia, which is resulting in a dilated, a mega esophagus. Okay. Next, team 2.
Yes, ma'am.
Yes, ma'am.
Team 2 is there?
Yes, ma'am.
It's visible. The screen is visible to the two of you.
Yes, ma'am.
Okay. Okay. So this is your question. This is a simple round. I've not kept anything complicated. So think simple.
Ma'am, lateral X-ray showing calcification thyroid gland.
Okay. Good. So this is a lateral X-ray of which region?
Neck, ma'am. Neck.
Lateral X-ray of the neck showing calcification in an enlarged thyroid. Okay.
Yes.
Name one IV agent used in nuclear scintigraphy.
I don't know, ma'am.
What about your teammate?
Hello.
Indium, ma'am. Indium, ma'am.
You
Log
have
and
another 15 seconds.
Gallium, no? Or indium? Ga- Gallium?
That's your final answer. Your time is up. It's technetium pertechnate, isn't it? Okay. So it's technetium pertechnate that is used for scintigraphy. Okay. So next team 3. This team gets 10 points. Okay. Next team.
Yes, ma'am.
Team 3, you ready?
Yes, ma'am.
This is an acroconal polyp.
That is your diagnosis?
Yes, ma'am.
It's an antroconal polyp. Okay. Your next question. Crescent sign. Yes, you're right. So this is the crescent sign. It has another name. Any idea what the name is? You get your marks back. Any idea what the other name for this crescent sign is? Okay. So this crescent sign is also called as dot sign. Okay. So you can see a crescent. That is a black crescent seen behind the antroconal polyp hanging on from the nasopharynx. Okay. So this is called as the crescent sign. So these people get 20 points. 10 plus 10. Team 3. Okay. So next do we have team 4, which is ready?
Yes, ma'am. Yes, ma'am.
Team 4, you're ready? Both of you are
Yes,
there?
ma'am. Yes, ma'am. Are you sure?
Mucocele of the frontal sinus.
Anything else?
Potts puffy tumor. Potts puffy tumor.
Okay, this is Potts puffy tumor. Okay, your next question. What is frontal recess?
Frontal sinus.
Ma'am, that drainage, is it the drainage of the frontal sinus, like small opening?
It is the?
It is below the frontal sinus where it can drain.
Drainage into the middle meatus.
Yeah, exactly. So frontal recess is nothing but the area where the frontal sinus ostium opens into. Okay, so it's the anterior part of the middle meatus into which the frontal sinus drains through an ostium. That is what is called as the frontal recess. This is the Potts puffy tumor. You're right. Okay, so this team gets 20 points, 10 plus 10. Next team 5.
Yes, ma'am.
Yes, ma'am.
Team 5, are you there?
Yes,
Yes,
You can see clear, right? Yeah. This is an acute presentation. What could be the diagnosis?
Is it acute retropharyngeal abscess, sorry?
I think बोल दे.
Ma'am, acute retropharyngeal abscess.
Or
acute retro. Yeah.
Or a pre-vertebral abscess, no single swelling.
So acute presentation, no?
It can be pre-vertebral also, because single side. What do you think?
That is your final answer?
I think it's acute is retropharyngeal abscess only.
Okay, fine. Okay, yes, ma'am. Answer.
That is your final answer? It's an acute retropharyngeal abscess?
Because ma'am, it's on the one side, like it's not the entire pharynx, some part of the pharynx.
No, there could be some other lateral abscesses also, right? Yeah, your time is up. Time is up. So this was your other question. So this is a peritonsillar abscess. Okay, or a quinsy. Okay. if we have to give a retropharyngeal abscess, we will straight away give you the X-ray picture, which will beautifully show the straightening of the spine. Okay. But whenever we are giving you this kind of a picture to show you the lateral swelling, okay, so you'll have to think in terms of any lateral based abscess. Okay. So the next question was, what is hot tonsillectomy? Tonsillectomy done at the time of acute episode, which is not done. Okay, which is usually not done. Now, team 5, no points for them. Okay, so can we have the scores on display? We'll break for 2 minutes, after which we'll continue. Okay. Yeah, can I have your attention? Do I have my participants with me? Yes.
Yes,
Okay.
ma'am.
Okay. So we'll start off with the next round of the diagnostics. Okay. Again, we have a series of images, and you'll have to, the difficulty level is one more ahead. Okay. So you have to look at the image and answer the question given. It's the same thing. The difficulty level is a little more than what was shared just now. Screen C. Yeah. Okay, team one. Team one?
Yes, ma'am.
Okay, this is your question.
Vivek, look at the pointer.
Shows vitreous part of temporal bone, posterior part, some mass or something. The
Is it
is it?
the glomus tumor?
It's not. I don't think it is glomus tumor. Vitreositis, vitreous abscess, or something like that.
Okay. Tell the sign. But I'm also not remembering.
I don't know this.
5, you have 15 seconds left.
Is it
Your time is up.
Phelps sign?
Your time is up. You gave me the answer after the time is up. That is the Phelps sign. Okay, so these were your questions. So this is the Phelps sign. What is the Phelps sign? Can you tell me what is the Phelps sign?
Loss of the crest between the jugular bulb and carotid.
Yeah, very good. Maybe a few more seconds would have got it right. Okay, so whenever there's a glomus tumor there, the jugulo-carotid crest is lost. That is what is called as the Phelps sign. And the 3 types of tumors that we see in MEN2 syndrome: MTC, parathyroid tumors, and pheochromocytoma. So these people don't, team 1 gets no point for this round. Next, team 2, are you ready?
Yes, ma'am.
Both of you? Yeah? This is your question.
Allergic fungal signs are double density sign மாதிரி இருக்கு. Akash?
Okay, நான் சொல்றேன்.
Ma'am, allergic fungal sinusitis, ma'am.
Allergic fungal sinusitis, okay.
Double density sign.
What is this sign seen?
Double density sign.
Double density sign. What is the double density sign?
Ma'am, there will be, it will not be homogeneous, and there will be difference in the appearance of the.
One is nice one, another is more dense.
Solla Akash.
There will be difference in absorption of ISO, hyper, and hypo.
There will be difference in
Fungal IFA, ma'am.
Okay, so you got the sign right. It's the double density sign. You get 20 points for this. Okay, so it is allergic fungal sinusitis. Okay, a polyposis, and the double density sign, that is due to concentration of metals. okay, the fungal hyphae, there are certain concentrates that are present which give the double density sign. It is clearly seen here, this image here. And this is called as the soft tissue window. Okay, so we have two windows in CT of the paranasal sinus that we primarily consider. One is the bone window, one is the soft tissue window. And in the soft tissue window, when we see the density of the soft tissue is variable, that is what is called as the double density sign. Okay, so these people get 20 points for their the team 2 gets 20 points. Okay. Now, team 3, are you there? Team 3?
Yes, ma'am.
So, your question is here.
Is it mastocytitis?
That is your final answer?
Is it acoustic neuroma?
Where is the neuroma? Where did you see the neuroma? You have, yeah,
Mastocytitis is the answer.
your time is up. Time is up. This is your next question. So I think you can see it here clearly, no? The breach in the bone.
Trauma.
Yes or no? So this is
Yes.
a longitudinal fracture of the temporal bone. Okay. And it is commonly associated with bleeding and otorrhea in the ear. Okay. So team 3, they don't score a point. Okay. Next, team 4, are you ready? Yeah, team 4, are you there?
Yes, ma'am. Hey, what, yeah? Hey, அந்த esophagus என்னது? லவுடா பேசு, லவுடா பேசு.
இரு.
ஏதாவது esophagus stricture-ஆ?
Yeah. What is the answer?
Is it some esophageal stricture?
Okay, what is this study? What is this study that is done?
Contrast CT.
Contrast?
MRI.
What is used for studying the esophageal defects?
Filling defects, ma'am. Is it barium சொல்லவா?
இது எப்படி barium சொல்லலாம்?
சரி இல்ல sorry. Ma'am, some contrast study.
Okay, you get 5 points for this. Okay, that's all you get because you identify the stricture as the answer. Okay, that is the answer.
Cox?
It's a contrast study which is showing you can see the stricture here, anterior stricture here.
Yes, ma'am.
Okay, so that is the
But we never saw the second question.
only if you get the first question right, you get the second question, no? Okay. So corkscrew esophagus, that is the answer. Okay. So this team gets 5 points because they got the stricture right. Okay. Next, team 5, are you there?
Yes, ma'am.
Yes, ma'am.
This is your question.
Just conca bullosa, no?
Yeah, conca bullosa. And Haller
Conca
cell
bullosa,
also.
ma'am.
Haller cell also.
Haller cell, no, conca bullosa is more problem. Conca bullosa.
Okay, of which side?
That's
Left side.
where is.
Okay.
Left side, na? Next question.
Uh-huh.
This is your next question.
Ma'am, osteomeatal complex where all the sinuses drain in the middle meatus.
Okay.
So it is associate, like when it is involved, it causes chronic sinusitis.
Okay.
Blockage of it.
Blockage of the osteomeatal complex is the main reason for sinus pathology. So these people get 20 points for this question. So that's a conca bullosa, which is rheumatization of the middle turbinate, all the way seen up to the skull base. And osteomeatal complex is nothing but a intricate structure in the middle meatus where the anterior group of sinuses drain. Okay. Now, can we have the scores on display? They will have it on display. Yeah. Let us have the scores on display now. I want you to put the So, dear students, you've seen your scores. So now we have the last round, which is the rapid fire round. Okay. So before the rapid fire round, the rapid fire is going to get over in say 10 minutes. So before that, we take a 5 minutes break. After which, I want all of you geared for the rapid fire. Okay, I'll put up the rules of the rapid fire just before we start. So you have a 5 minutes break now, and this is your final round, rapid fire. Go energize yourself, get some glucose, and get back. 5 minutes. Okay. Yeah, do I have my participants with me? My team members, are you there?
Yes, ma'am.
So we come to the final round of our quiz. I hope it's been a memorable journey for all of you. Out of the 525 teams that participated, it's the 5 of 5 teams that have been selected. So I think it's a great pride that you people are here with us. Now, team 1. Okay, before we start with the rapid fire round, let me make the rules clear to you. So you have to answer as many questions as you can in 60 seconds. Okay, so 60 seconds is all the time you have to answer as many questions as you can. You get 5 points for each correct answer, minus 2 points for any wrong answer, incorrect answer. But you can pass. Okay, if you don't know the answer, instead of answering it wrong, you can pass. Okay, so these are the rules of the round 4, that is the rapid fire round. Okay, now this is it's clear with all of you, right? Clear? All clear?
Will the questions be displayed on the screen?
No, the questions are not going to be displayed.
Okay, and if
The
we pass
timer
the
will
question,
be displayed. Yeah.
Okay, if we pass the question, if there is time left, will it be repeated?
You will go back to it. You answer all the questions.
No, I think you will not be able to go back to the questions.
No, like even though 60 seconds out of 60 seconds time is remaining, can we go back to the question?
Yeah, you can go back to the question. You want to go back to the previous question after you've answered all your questions. That's what you want to answer.
Yeah.
Okay, you can go back to the previous question. So you want to keep passing and then go back to the question later, is it? Okay.
Yeah.
Anyways, as you like it. But remember, there is negative marking for this round. Okay. And you have to be loud, and your final answer, give it as your final answer. This is our final answer. Okay. You have to be loud and clear. So this is our final answer. Only then we consider that. Okay. So team 1, we start off with you again.
Yes. Vivek, are you ready?
Yeah.
Yeah, I'm ready. I'm ready.
The two of you are ready, right?
10 seconds is sure. Final you should tell. Okay.
Yes.
Your
Yes.
connectivity is not very good. Vivek, your connectivity is not very good.
I'm audible right now.
You're
Video
audible.
is not seen.
Okay.
Your video is not seen.
Yeah. Team 1, we'll start off with the rapid fire round. And here we go. Lower esophageal ring seen at the junction of squamous and columnar epithelium is also called as?
Shadsky B ring.
Okay, 1 plus. Positive Fruitzenberg sign. Test seen in?
Meningoencephalocele.
Okay, right. Radiological sign seen in acute laryngotracheobronchitis.
Steeple sign.
What's your final answer?
Steeple sign.
Right. In carcinoma of base of tongue, pain is referred to the ear through?
Glossopharyngeal nerve.
Right. Pneumotocele or aerocele is seen in which sinus?
Pass.
Rate at which the nasal mucus secretions is cleared by the cilia?
5 to 10 mm per minute.
You're right. 5 to 10 mm per minute is the right answer. Bony upper 1/3 of the external nose is formed by how many paired bones?
2.
Right. Wave 6 of Bera corresponds to? Interior, is it clear? Colliculus, true or false?
True.
Right. What type of leaf-out fracture is craniofacial disjunction?
Type 3.
Wrong.
3.
Wrong. That
Type
is
3.
wrong. Okay. So other questions, they got it right. One pass, one negative, and the others are right. So one you have not attempted. Okay. So out of the 9 questions they've attempted, one was passed and one is a negative mark. Okay. So that's a good score.
Ma'am, but isn't craniofacial disjunction type 3 only?
Type 2 it is, no?
It is type 3 only, no, ma'am. As far as I've read it.
3. Type 2 is pyramidal.
Yeah, type 2 is pyramidal.
Type 3 is
I'll get back to you on that. I'll get back to you on that.
Yeah.
Okay, so this is their score. Next, do
What
we
is
have
our
the
score,
next
ma'am?
team? You have scored how many questions they got right? 7? 35? 33, yeah. 33. We'll finalize that. Next.
Yes, ma'am.
The next team. Team 2, are you ready?
Yes, ma'am.
So, team 2, your rapid fire questions start now. Picadilly circle is the other name for?
Osteometrial complex.
Right. Which state whether it's true or false. Pain from the anterior two-third of the tongue is referred to ear by cauda tympani nerve.
False.
False is right.
False.
Mouse nibble appearance of vocal cords is seen in? Mouse nibble appearance of vocal cord. Pass. Okay. Which type of thyroid carcinoma is associated with men 2A and 2B?
Ma'am, the previous question is TB larynx.
Yeah, that is right.
TB larynx, ma'am.
Now, the next question was which type of thyroid carcinoma is associated with MEN2A and 2B?
Medullary carcinoma.
Medullary carcinoma is right. Name the instrument used for posterior rhinoscopy.
Pass, ma'am.
Name of the instrument used for posterior rhinoscopy.
Next, ma'am.
Pass. In facial nerve palsy of the right side, stapedial reflex will be absent on which side?
Right side, ma'am.
Right side.
Right side.
That's your final answer, right? Perceiving smell in the absence of odorous substance is called as what?
Anosmia. No, ma'am, anosmia. It's not anosmia. It's for parasmia, ma'am.
Anosmia is your answer?
No, ma'am, parasmia, ma'am. Perversion of it's actually audited hallucination, ma'am.
You want me to consider this answer or no? You get a negative mark for this answer.
What, ma'am?
It's a negative mark for this answer.
Which answer, ma'am? Which answer?
The last answer that you gave, it's phantosmia, isn't it? Perversion
Yes,
of smell is parosmia.
Yeah. Okay. Yes,
okay. So that brings it to the end of the rapid fire round for team 2, and they have got 5 questions right, and 1 is a wrong answer. 1 they have passed. Okay. Now team 3. Team 3, gear it up.
Yes, ma'am.
Just a while. Yeah, team 3. Are you there?
Yes, ma'am.
Okay. So here we go. Fibers at the lower end of esophagus are thickened to form cardiac sphincter. What type of fibers?
Pass.
Okay. Your next question is, name the theory of polysteatoma suggesting metaplasia of middle ear epithelium.
Sage theory.
What theory?
Sage.
Sage is right. Okay. What is the space between alar fascia and prevertebral fascia called?
Danger space.
Danger space is right. Inferior vestibular nerve supplying posterior semicircular canal is also called as what nerve?
Singular nerve.
Singular nerve is right answer. Which is a septum which separates superficial squamous cells from the deep petrosal cells?
Corner septum.
Corner septum is right answer. Dieter cells lie outside the cells of Hansen. True or false?
False.
False is right. Appearance of fibrous dysplasia on maxilla on CT scan. What is the appearance called as? Pass? Okay.
Yes.
Name of the criteria used for diagnosing Ludwig's angina. Pass. Wave 3 of Bera is obtained from which part of the auditory pathway?
Cochlear nuclei.
That is the right answer. Okay. We're done with your time. So how many questions have they got it?
7 correct. 3 first.
Okay. So you have got 7 questions right and you've passed 3 questions. Okay.
6.
Sorry. 6 questions you got it right. 6 questions are right and you passed 3. Yeah. One more is left here. 6 questions are right. The one who's keeping the score, Yash, 6 questions were right. So give them points for 6 questions.
Yes.
Rutvika and Yash.
Yes. That's correct. That's correct. It's 6 questions.
Yeah. Now team 4.
Yes, ma'am.
Yeah, just a while. I will start off your rapid fire.
Are you sure?
I want it loud and clear. The final answer, okay?
I should come closer and say, where are you?
I'm close to the mic, sir.
Okay. So if the team 4 is ready,
Yes, ma'am.
sure we go. Motor nerve supply of the strap muscles is by?
Pass.
Motor nerve supply of the strap muscles is by which nerve?
The answer is cervicalis. Answer
Oh.
cervicalis.
Okay. Pink tympanic membrane seen in which condition?
Otosclerosis.
Cochlear implant electrodes are placed in which part of the inner ear?
Scala tympani.
Right. Turbinate that articulates with ethmoid.
Inferior turbinate.
What's your answer?
Inferior turbinate.
Yeah, right. Nodes of Rouvier is located in which space?
Retropharyngeal space.
Yes, you're right. Lateral pharyngeal recess is the most common site for nasopharyngeal carcinoma. True or false?
Yes, ma'am.
True.
True. Yeah, you're right. Shape of larynx in adults. What is the shape of larynx in adults?
Funnel shape. Funnel.
Say pass.
Pass.
Okay.
Transition between circular layer of esophagus and oblique fibers of stomach is called as?
Pass.
Surgical landmark for endolymphatic sac.
Donaldson's line.
Line. Very good. Now you want to take the past questions?
Yes, ma'am. Pass.
Esophagus enna? அது தெரியல டைம் முடிஞ்சு.
You're done. Okay, so how many questions did they get it right?
7.
They got 7 questions right. Okay. So next, the last team and the last round of questions for today. Do we have the last team?
Yes, ma'am.
Yes, ma'am.
Okay. So So here we go. Incustra2020 joint is a what type of joint?
Ball and socket.
Right. Surgical landmark for posterior cranial fossa.
I don't know. Pass.
Which segment of facial nerve is the narrow segment?
Labyrinthine.
Labyrinthine.
Right. Which PNS is most pneumatized at birth?
Ethmoid.
Ethmoid is the right answer. Most common type of tracheoesophageal fistula?
Type C.
Right. Space of Tucker is also called as?
Pre-laryngeal. What is that called, Sarah? Pre-laryngeal space?
याद नहीं आ रहा क्या था
Ma'am,
pass
pre-laryngeal space. No?
What is your answer? Pass, is it?
Pass, ma'am. Yes, ma'am.
Okay. Which is the nerve of the fourth arch?
I don't remember. Pass.
facial.
Pass.
Is that your answer?
Ma'am, pass.
Pass. Okay. Precellar is the most common type of sphenoid pneumatization. True or false?
False. False.
False is right. Now, colorectal fistula is what type of anomaly?
Ma'am, it is the connection between the external auditory canal opening into the mandible. Congenital anomaly.
Okay. So they get one more point for that. How many questions have they answered? You answered 6 questions, right? Okay. So they get 30 points. Okay. So, yeah. With this, we come to the end of this quiz that is going on from the last 1 month. So I hope you all have had a good learning experience.
Ma'am,
Yeah.
I have a question.
Yeah.
Yeah, about the Leaford fracture, type 3.
Yeah.
Yeah, I think the answer is correct, ma'am. Type 3 is craniofacial disjunction.
Even I think it's right. I'll just get back to you. Yeah, that is right.
Okay.
They get another 5 points for that. 40. Yeah. Okay, so with this, we come to the conclusion of this quiz, and you all have done a great job. So, can we have the scores on display? Rutvika and Yash. Okay, in the meanwhile, I have some questions for the audience. If anybody is interested in answering this, I cannot put this up. The questions up. So we'll see the scores and then we'll go ahead. Total scores. So again, can I have some interaction from the students? You can give me a positive feedback, negative feedback. For me, it has been a very welcoming break from the COVID duty. Very refreshing. Back to academics. So we have the final score here. Correct. 40 here. Yeah, Yash, can you please make a correction? Rutvika and Yash, round 4, team 1 gets 40 points.
We get 38. We got one wrong, so it is 38.
That was the correct.
So it is.
One negative, we have removed that.
Which one did we get wrong?
No, we've corrected that. That is a Leaford's fracture.
Oh, okay.
Yeah. So we got all right.
That, you got all right, and you get 40 points for that. Okay, so first of all, I must again congratulate all of you. You made it from the 525 teams. That is a real good job. You all must be glued to your books, otherwise this wouldn't have been possible. And here's wishing you all the best for all your future endeavors. You win, you lose, it really doesn't matter. But the way you participated, we really appreciate it. Okay, so this is the score, final score. And we have the team 1. Team 1, can I have your names, please?
Ma'am, I'm Vivek.
Vivek and?
I'm Aditi.
Vivek and Aditi from which college?
Kasturba Medical College, Manipal.
Excellent. I'm so proud that you people are from Karnataka. Okay, so
thank you, ma'am.
Thank you, ma'am.
The team 4. Next on is team 4.
This is Janvi.
Janvi.
Aishwarya.
Janvi and Aishwarya from?
Madras Medical College.
Madras Medical College. Excellent. So the second place goes to Janvi and Aishwarya from Madras Medical College. And the third place goes to team 3. Team 3, can you all introduce yourselves again?
This is Siddharth and my teammate is Sita Pragya from AIMS Bhubaneswar.
Okay. So great. From all across India, we have students who participated, and hats off to you all for making it to the finals and doing so well in the finals. I put a lot of questions which was meant for postgraduate students, but some of you cracked even that. So great going. Wishing you all the best for all your future endeavors. And we will send across your prize money. Also, the team 1, which is won the first prize, will get a subscription for 3 months to Marrow online coaching. Okay. And regarding any queries, you can always get back to us. And thank you for making it to the finals today, and making it a grand success. Thank you all so much.
Thank you, ma'am.
Thank you, ma'am.
It was a great pleasure hosting you.
Thank you, ma'am.
Thank you.
Thank you. Thank you, ma'am.
Yeah, excellent. Bye. Have a good night.
Good night, ma'am.
Good night, ma'am.
Yeah, good night.
Right, ma'am.